Good afternoon, class. Cô xin chào cả lớp. Today we will continue with listening and reading. Thì hôm nay chúng ta sẽ đi hai cái phần chính nhé, là phần listening và phần reading nha. Phần reading á, thì mình sẽ qua cái chương 5, chapter 5. Còn phần listening á, thì mình đi audio 6. Audio 6 nha. Rồi, cô mời các bạn bây giờ mình mở sách xanh lá cây. Hôm nay là hai cái phần này nằm trong sách xanh lá cây nhé. Ở phần sau á, hôm trước mình đã nghe được audio 5. Bây giờ các bạn mở ra đọc đề dùm cô audio 6. Task 6. Rồi, cô share màn hình để các bạn dễ xem nè. Task 6 của mình á, là mình nói về multiple sclerosis. This is audio 6 chapter 5. Đó là nó liên quan tới cái hệ thần kinh. Hôm nay mình cũng qua cái hệ thần kinh. Thì mình sẽ nghe một cái bài là về multiple sclerosis. Thì cái task của mình đó là listen and complete the sentences. Number 1, multiple sclerosis is a what disease of the? Number 2, multiple sclerosis is caused by the body's what? Attacking and healthy cells for no clear reason. Number 3, the what is destroyed in pathways. Number 4, nerve cannot be properly. Number 5, functions such as and may be lost. Number 6, symptoms range from numbness and to paralysis, a loss of control of the end. Thì đây là một số cái câu hỏi mà mình sẽ chuẩn bị mình nghe để mà mình điền đó. Các bạn có thể đoán thử trước khi mình nghe. Và trước khi mình nghe thì mình sẽ xem một cái video clip ngắn để nói về cái đa xơ cứng ha.
I'm Dr. Oliver Tobin, a neurologist specializing in multiple sclerosis at Mayo Clinic. In this video, we'll be covering the basics of multiple sclerosis. What is it? Who gets it? The symptoms, diagnosis, and treatment. Whether you're looking for answers about your own health or that of someone you love, we're here to provide you with the best information available. Multiple sclerosis is a disorder in which the body's immune system attacks the protective covering of the nerve cells in the brain, optic nerve, and spinal cord, called the myelin sheath. And this sheath is often compared to the insulation on an electrical wire. When that covering is damaged, it exposes the actual nerve fiber, which can slow or block the signals being transmitted within it. The nerve fibers themselves might also be damaged. The body can repair damage to the myelin sheath, but it's not perfect. The resulting damage leaves lesions or scars, and this is where the name comes from: multiple sclerosis, multiple scars. Now, everyone loses brain cells and spinal cord cells as they get older. But if part of the brain or spinal cord has been damaged by MS, the nerve cells in that area will die off faster than the areas around it that are normal. This happens very slowly, usually over decades, and typically shows up as gradual walking difficulty happening over several years. When you read about multiple sclerosis, you may hear about different types, the most frequent being relapsing remitting multiple sclerosis. And this is characterized by attacks or relapses. We don't know what causes MS, but there are certain factors that may increase the risk or trigger its onset. So while MS can occur at any age, it mostly makes its first appearance in people between the ages of 20 and 40. Low levels of vitamin D and low exposure to sunlight, which enables our body to make vitamin D, are associated with an increased risk of developing MS. And people who have MS who have low vitamin D tend to have more severe disease. So people who are overweight are more likely to develop MS, and people who have MS and are overweight tend to have more severe disease and a faster onset of progression. People who have MS and who smoke tend to have more relapses, worse progressive disease, and worse cognitive symptoms. Women are up to 3 times as likely as men to have relapsing remitting MS. The risk for MS in the general population is about 0.5%. If a parent or sibling has it, your risk is about twice that, or about 1%. Certain infections are also important. A variety of viruses have been linked to MS, including Epstein-Barr virus, which causes mono. Northern and southern latitudes have a higher prevalence, including Canada, the northern US, New Zealand, southeastern Australia, and Europe. White people, especially of Northern European descent, are at the highest risk. People of Asian, African, and Native American ancestry have the lowest risk. A slightly increased risk is seen if a patient already has autoimmune thyroid disease, pernicious anemia, psoriasis, type 1 diabetes, or inflammatory bowel disease. Symptoms of a relapse usually come on over 24 to 48 hours, last for a few days to a few weeks, and then improve in the region of 80 to 100%. Those symptoms include loss of vision in an eye, loss of power in an arm or leg, or a rising sense of numbness in the legs. Other common symptoms associated with MS include spasms, fatigue, depression, incontinence issues, sexual dysfunction, and walking difficulties. There's currently no single test to make a diagnosis of MS. However, there are 4 key features which help to secure the diagnosis. Firstly, are there typical symptoms of multiple sclerosis? Again, those are loss of vision in an eye, loss of power in an arm or leg, or sensory disturbance in an arm or leg lasting for more than 24 hours. Secondly, do you have any physical examination findings consistent with MS? Next is the MRI of your brain or spine consistent with MS. Now here it's important to note that 95% of people over the age of 40 have an abnormal brain MRI, just the same as many of us have wrinkles on our skin. Lastly, are the results of the spinal fluid analysis consistent with MS? Your doctor may recommend blood tests to check for other diseases that share the same symptoms. They may also recommend an OCT test, or optical coherence tomography. This is a short scan of the thickness of the layers at the back of your eye. So the best thing to do when living with MS is to find a trusted interdisciplinary medical team that can help you monitor and manage your health. Having a multidisciplinary team is essential for addressing the individual symptoms that you are experiencing. If you have an MS attack or relapse, your doctor may prescribe you corticosteroids to reduce or improve your symptoms. And if your attack symptoms do not respond to steroids, another option is plasmapheresis or plasma exchange, which is a treatment similar to dialysis. About 50% of people who do not respond to steroids have a significant improvement with a short course of plasma exchange. There are over 20 medications currently approved for prevention of MS attacks and prevention of new MRI lesions. And learning to function with MS can be challenging. There are medical experts ready to work with you to help you manage it so you can still live a full life. Consulting with a physiatrist, physical or occupational therapist can help you deal with physical difficulties. Physical activity is strongly recommended for all people with MS. Mental health is also an important consideration, so keeping up personal connections with friends and family and trying to stay involved with your hobbies is important. But also be kind to yourself and realistic about what you're up for. This can change from day to day, so it's okay to give yourself permission if something seems like too much or if you need to cancel plans. You may also find support groups helpful to connect with people who understand what you're going through and discuss your feelings and concerns with a doctor or counselor. Meanwhile, scientists are hard at work expanding our understanding of this disease and developing new treatments and medications which are ever more effective. If you want to learn more, watch more of our videos or visit mayoclinic.org. We wish you well.
The nervous system is the information network that's necessary to make all of the body work together. Muscles don't contract until they get the message to contract, which comes from the brain, going through the spine, out through the peripheral nerves, and then to the muscles. We have the central nervous system, which is the brain, the spinal cord, and the optic nerves. And then you have what we call the peripheral nervous system, and that's attached to the central nervous system. It's smaller nerves as they leave the spine and go out to the edges of the body, so the fingertips and the toes and basically everywhere. Multiple sclerosis happens to attack just the central nervous system, so the brain, the spinal cord, or the optic nerves. But obviously that can impact pretty much any part of your body. Multiple sclerosis is an autoimmune disease where the immune system, which is supposed to be your body's armed forces, protecting you from infections and things on the outside. But in the case of MS, it gets its orders confused, and instead of attacking germs and things like that, it attacks the brain, the spine, and the optic nerves. So because the central nervous system have connections to the entire body, the symptoms that are caused by multiple sclerosis are very different depending on what part of the central nervous system is being attacked by the immune system at any given time. Initially, for most people, it presents as a relatively sudden onset of neurologic symptoms. That could be loss of vision, it could be trouble walking, it could be numbness, and it's very much a change from what normal should be. And when we look at the person's MRI, we find inflammation, and that's the immune system causing damage. If left to itself, MS tends to just become what we call progressive, which just means people slowly get worse over many years, and that is something we want to avoid. In the early 1990s, there were no treatments for multiple sclerosis. Zilch, nada, not a thing. Now we have over 20 different immunotherapies that can control the disease. And while they're not cures, they can effectively put the disease into remission for many, many years. And so the first changes in MS are most likely immunologic changes. And Yale, as an immunologic powerhouse, is uniquely suited to do this kind of deep inquiry into these patients' immune systems and tease out what's gone wrong. The frontier for multiple sclerosis is on both ends. First, find it earlier, treat it earlier. Maybe we can prevent it. But also, for the patients who have lived with the disease for many years, how can we improve their lives, improve their level of function? So I think on both ends of the spectrum, there's room for improvement.
Multiple sclerosis, it's activated by myelin. Once the Multiple sclerosis is a demyelinating disease of the central nervous system, which includes the brain and the spinal cord. Myelin is the protective sheath that surrounds the axon of neurons, allowing them to quickly send electrical impulses. This myelin is produced by oligodendrocytes, which are a group of cells that support neurons. In multiple sclerosis, demyelination happens when the immune system inappropriately attacks and destroys the myelin, which makes communications between neurons break down, ultimately leading to all sorts of sensory, motor, and cognitive problems. Now, the brain, including the neurons in the brain, is protected from things in the blood by the blood-brain barrier, which only lets certain molecules and cells through from the blood. For immune cells like T and B cells, that means they have to have the right ligand or surface molecule to get through the blood-brain barrier. This is kind of like having a VIP pass to get into an exclusive club. Once a T cell makes its way in, it can get activated by something it encounters. In the case of multiple sclerosis, it's activated by myelin. Once the T cell gets activated, it changes the blood-brain barrier cells to express more receptors, and this allows immune cells to more easily bind and get in. It's kind of like bribing the bouncer to let in a lot of people. Now, multiple sclerosis is a type 4 hypersensitivity reaction, or a cell-mediated hypersensitivity. And this means that those myelin-specific T cells release cytokines like interleukin-1, interleukin-6, tumor necrosis factor alpha, and interferon gamma, which together dilate the blood vessels, which allows more immune cells to get in, as well as directly cause damage to the oligodendrocytes. These cytokines also attract B cells and macrophages as part of the inflammatory reaction. Those B cells start to make antibodies that mark the myelin sheath proteins. And then the macrophages use those antibody markers to engulf and destroy the oligodendrocytes. Without oligodendrocytes, there's no myelin to cover the neurons. And this leaves behind areas of scar tissue, also called plaques or sclera. In multiple sclerosis, these immune attacks typically happen in bouts. In other words, an autoimmune attack on the oligodendrocytes might happen, and then regulatory T cells will come in to inhibit or calm down the other immune cells, leading to a reduction in the inflammation. Early on in multiple sclerosis, the oligodendrocytes will heal and extend out new myelin to cover the neurons, which is a process called remyelination. Unfortunately, though, over time as the oligodendrocytes die off, the remyelination stops, and the damage becomes irreversible with the loss of axons. Just like other autoimmune diseases, the exact cause of multiple sclerosis is unknown, but it's linked to both genetic and environmental factors. Genetic risk factors include being female and having genes that encode a specific type of immune molecule called HLA-DR2, which is used to identify and bind to foreign molecules. Environmental risk factors might include infections as well as vitamin D deficiency, which is an interesting one because it might help explain why the rates of multiple sclerosis are higher at the northern and southern poles compared to the equator, where there's a lot more sunlight. Together, these genetic and environmental influences might lead to the body not killing off immune cells that target myelin. So it turns out that there are actually 4 main types of multiple sclerosis, based on the pattern of symptoms over time. To break this down, we can use a graph with time on the x-axis, where time refers to the lifespan of the individual, and disability on the y-axis. The first and by far the most common pattern of multiple sclerosis is called relapsing remitting multiple sclerosis, or RRMS. This condition is what we just described, bouts of autoimmune attacks happening months or even years apart, and causing an increase in the level of disability. For example, during a bout a person might lose some vision, but then it might be followed by improvement if there's remyelination. Unfortunately though, more often than not, the remyelination process isn't complete, so there's often some residual disability that remains. And that means that with each attack, more and more the central nervous system gets irreversibly damaged. In the relapsing remitting multiple sclerosis type, there's typically no increase in disability between bouts, so the line stays flat during that time. Now, the second type is called secondary progressive multiple sclerosis, or SPMS, which initially is pretty similar to the relapsing remitting type, but over time the immune attack becomes constant, which causes a steady progression of disability. The third type is primary progressive multiple sclerosis, or PPMS, which is basically one constant attack on myelin, which causes a steady progression of disability over a person's lifetime. The final type is progressive relapsing multiple sclerosis, or PRMS, which is also one constant attack, but this time there are bouts superimposed, which means the disability happens even faster. Specific symptoms vary a lot from person to person, and largely depend on the location of the plaques, and multiple sclerosis typically affects individuals between the ages of 20 and 40. Symptoms related to bouts can typically worsen over weeks and can linger for months without treatment. One common trio of multiple sclerosis symptoms is called Charcot's neurologic triad, and it includes dysarthria, which is difficulty or unclear speech, nystagmus, which is involuntary rapid eye movements, and an intention tremor. Dysarthria is due to plaques in the brainstem that affects nerve fibers that control muscles of the mouth and throat. And this can interfere with conscious movements like eating and talking, and could lead to things like a new stutter, as well as unconscious movements like swallowing. Nystagmus is due to plaques around the nerves controlling eye movements. Plaques around the optic nerve causes loss of vision in one or both of the eyes because of damage to the optic nerve, which is called optic neuritis. Sometimes there's blurring or graying of the vision, or alternatively there might be a dark point in the center of vision. Additionally, if there's damage to the nerves controlling eye movement, then eye movements can be painful and there can even be double vision, if the eyes no longer move in a coordinated way. Finally, intention tremors can be caused by plaques along the motor pathways in the spinal cord, which can affect outbound signals like skeletal muscle control. Motor symptoms can include muscle weakness, muscle spasms, tremors, and ataxia, which is a loss of balance and coordination. In serious cases, this can lead to paralysis. In addition, plaques in the sensory pathways can affect inbound signals, like sensations from the skin, which causes symptoms like numbness, pins and needles, and paresthesias, which are often a tingling feeling but might also be a painful itching or burning sensation. Occasionally, there can be very specific sensory symptoms, like Lhermitte sign, which is when an electric shock runs down the back and radiates to the limbs when a person bends their neck forward. Plaques can also involve the autonomic nervous system, which can lead to bowel and bladder symptoms like constipation and urinary incontinence, as well as sexual symptoms like sexual dysfunction. Finally, multiple sclerosis can also affect higher order activities of the brain, causing poor concentration and critical thinking, as well as depression and anxiety. Multiple sclerosis is typically suspected when there are multiple neurologic symptoms separated in space, which is attributable to damage in different locations in the nervous system, as well as time, meaning separate bouts or flare-ups, as well as remission. The diagnosis of multiple sclerosis is supported by an MRI that shows multiple central nervous system lesions, called white matter plaques, since these regions tend to have a lot of myelin. Also, in the cerebrospinal fluid, there might be high levels of antibodies, which indicates an autoimmune process. Finally, a visual evoked potential can be helpful as well, which measures the nervous system's response to visual stimuli. For treatment, there's no cure for multiple sclerosis, but there are medications which are particularly effective for the relapsing remitting type because they lessen the severity of relapses and make them happen less frequently. Medications like corticosteroids, cyclophosphamide, which is a cell cycle inhibitor, and intravenous immunoglobulin can all be used to help blunt the autoimmune process. In addition, plasmapheresis can be effective as well, which is when the plasma is filtered to remove disease-causing autoantibodies. Chronic treatment for multiple sclerosis includes immunosuppressants like recombinant beta interferon, which decreases the level of inflammatory cytokines in the brain, as well as increases the function of T regulatory cells. Other immunosuppressants actually block T cells from getting into the brain by interfering with the cell surface molecules they use to gain passage through the blood-brain barrier. Unfortunately, though, there are fewer treatment options available for progressive multiple sclerosis. Instead, treatments are often targeted at managing specific symptoms, everything ranging from depression to bladder dysfunction. Physical therapy and cognitive rehabilitation therapy can be particularly helpful with sensory, motor, and cognitive symptoms. Finally, there's also an increasing interest in the role of vitamin D as an effective treatment. Alright, as a quick recap, multiple sclerosis is a chronic and progressive autoimmune disorder, and the most common pattern is the relapsing remitting type, where individuals have flares that come and go, with each one slightly worsening their overall condition. During a flare, T cells cause inflammation and damage to oligodendrocytes in the central nervous system, which leaves behind scarred areas of demyelinated neurons called plaques, which causes a variety of symptoms depending on the location. Thanks for watching. You can help support us by donating on Patreon, subscribing to our channel, or telling your friends about us on social media, with each one slightly worsening their overall condition.
Okay, that's it. Mình nghe cái đó ha. Rồi bây giờ bắt đầu mình qua cái phần cô chuyển slide. Quay lại cái phần trong sách của mình. Now we are going to listen for task 6. Thì nãy chúng ta đọc câu hỏi rồi, xem qua một số hình phân tích của multiple sclerosis. Bây giờ các bạn nghe trong đúng cái task này, mình điền được một chỗ trống và bị đa xơ cứng.
Chapter 5. The Nervous System, Part 1. Audio Script 6. Good morning, everyone. I'd like to welcome you again to City Hospital. As you may know, the hospital has recently been carrying out some research on various diseases of the nervous system So today, I'd like to talk to you about a progressive disease of the central nervous system known as multiple sclerosis. Multiple sclerosis, or MS, as it's sometimes referred to, is caused by the body's defense cells attacking and destroying healthy cells for no clear reason. When these defense or immune cells, as they're commonly known, attack the myelin sheath that covers some nerves in the brain and spinal cord, patches of the myelin sheath covering the axon are destroyed. Affected nerves can't, therefore, conduct nerve impulses properly. This means that functions such as movement and sensation may be lost. Any area of the body can be affected by MS. Symptoms range from numbness, which means loss of feeling and tingling, to paralysis and loss of control of the bowels and bladder. Episodes of symptoms are often followed by periods of remission or times when dramatic improvements may be made. Women are more likely to develop MS than men. Researchers have different opinions on the causes of this disease. However, they agree that they include genetic, environmental, and infectious factors. Interestingly, MS is more common in some ethnic groups than others and isn't particularly common in tropical climates. Symptoms usually develop in early adulthood. Spinal cord damage may cause tingling, which means an uncomfortable feeling in the arms and legs, weakness in the limbs, and possibly paralysis, meaning complete or partial loss of the ability to control movement. Damage to myelinated nerves in the brain may cause extreme tiredness, clumsiness, muscle weakness, slurred speech, blurred vision, numbness or facial pain. Episodes may last for several months, and after a remission period, a relapse often occurs. This may be caused by injury, infection or stress. Some people have mild relapses and long periods of remission, with few permanent effects. Others, however, become gradually more disabled after the first attack. A few suffer gross disability within the first year. There's no single diagnostic test for MS, but MRI, otherwise known as a brain scan, may show damage to myelinated nerves in the brain. At present, there's no specific treatment. Some people have claimed that dietary modifications, such as the inclusion of fish oils, are beneficial. In some cases, interferon drugs can extend the time between episodes and reduce the rate of decline. More controversial is the use of medical cannabis, which is said to alleviate symptoms in MS sufferers. Based on what we currently know about multiple sclerosis, City Hospital staff are now focusing on ways to specialise in treating this most debilitating disease.
Now, after we listen for the first time, we will check this together. Multiple sclerosis is a progressive disease, vậy đó là một bệnh tiến triển của hệ thần kinh trung ương các bạn. Đặc điểm thứ hai là MS caused by the body's defense cells, là gây ra do những cái tế bào bảo vệ đó, nó làm gì, nó tấn công và destroying, cái từ mình phải điền vô là tiêu hủy. Và nó phá hủy những cái tế bào khỏe mạnh for no clear reason mà mình không có biết lý do tại sao. Number 3, the myelin sheath is destroyed in patches. Cái bao myelin không bị phá hủy. Number 4, nerve impulses cannot be conducted properly. Cái xung thần kinh nó không thể nào nó truyền đúng cái chức năng của nó. Number 5, functions such as movement and sensation may be lost. Và một số cái chức năng như chức năng vận động, chức năng cảm giác có thể là bị mất đi. Number 6, symptoms range from numbness and tingling to paralysis and loss of control of the bowels and bladder. Một số cái triệu chứng như là numbness là bị tê cứng nè, tingling châm chích nè, cho đến là gì liệt và mất kiểm soát đường ruột và bàng quang. Đó là một số cái đặc điểm. Đó là một số cái đặc điểm ha. Now, habit number 7 to number 12. Episodes of symptoms are often followed by periods of remission. Những cái triệu chứng thì nó có những cái đợt nó thoái lui. Symptoms usually develop in early adulthood. Nó cũng phát triển sớm, các triệu chứng phát triển sớm. Episodes may last for several months, kéo dài vài tháng. There is no single diagnosis test for MS. Không có một cái test chẩn đoán nhất định nào. It is claimed that dietary modifications such as the inclusion of fish oils are beneficial. Thì một số cái phần bổ sung dinh dưỡng, ví dụ như là uống thêm dầu cá có lợi nè. Interferon drugs như là thuốc interferon can extend the time between episodes, có thể làm cái giãn cách của những cái đợt mà người ta sơ cứng nó thưa ra. Now we are going to listen again. Bây giờ các bạn nghe lại và đây là cái test script. Các bạn sẽ điền vào test script. Vừa chiếu phát một lượt test script trước này. Đây là slide 1. Slide 2. Nghe đi rồi chiếu lại cái đáp án nha. Slide 3. Này tới 20. Now, listen.
Chapter 5. The Nervous System, Part 1. Audio Script 6. Good morning, everyone. I'd like to welcome you again to City Hospital. As you may know, the hospital has recently been carrying out some research on various diseases of the nervous system. So today, I'd like to talk to you about a progressive disease of the central nervous system known as multiple sclerosis. Multiple sclerosis, or MS, as it's sometimes referred to, is caused by the body's defense cells attacking and destroying healthy cells for no clear reason. When these defense or immune cells, as they're commonly known, attack the myelin sheath that covers some nerves in the brain and spinal cord, patches of the myelin sheath covering the axon are destroyed. Affected nerves can't, therefore, conduct nerve impulses properly. This means that functions such as movement and sensation may be lost. Any area of the body can be affected by MS. Symptoms range from numbness, which means loss of feeling and tingling, to paralysis and loss of control of the bowels and bladder. Episodes of symptoms are often followed by periods of remission or times when dramatic improvements may be made. Women are more likely to develop MS than men. Researchers have different opinions on the causes of this disease. However, they agree that they include genetic, environmental, and infectious factors. Interestingly, MS is more common in some ethnic groups than others and isn't particularly common in tropical climates. Symptoms usually develop in early adulthood. Spinal cord damage may cause tingling, which means an uncomfortable feeling in the arms and legs, weakness in the limbs, and possibly paralysis, meaning complete or partial loss of the ability to control movement. Damage to myelinated nerves in the brain may cause extreme tiredness, clumsiness, muscle weakness, slurred speech, blurred vision, numbness or facial pain. Episodes may last for several months, and after a remission period, a relapse often occurs. This may be caused by injury, infection, or stress. Some people have mild relapses and long periods of remission, with few permanent effects. Others, however, become gradually more disabled after the first attack. A few suffer gross disability within the first year. There's no single diagnostic test for MS, but MRI, otherwise known as a brain scan, may show damage to myelinated nerves in the brain. At present, there's no specific treatment. Some people have claimed that dietary modifications, such as the inclusion of fish oils, are beneficial. In some cases, interferon drugs can extend the time between episodes and reduce the rate of decline. More controversial is the use of medical cannabis, which is said to alleviate symptoms in MS sufferers. Based on what we currently know about multiple sclerosis, city hospital staff are now focusing on ways to specialise in treating this most debilitating disease.
Now, check number 1, progressive to immune-free exon 4 conduct. Number 5, numbness. 6, rheumatic. 7, genetic. 8, tropical. 9, adulthood. 10, uncomfortable. 11, partial. 12, clumsiness. 13, blurred. 14, stress. 15, permanent. 16, disability. Number 17, diagnostic. 18, myelinated. 19, alleviate. 20, debilitating. Hoặc là mình có thể xem trong một cái bảng tổng này. Okay, that's it. Now, please have a look at chapter 5. Mời các bạn mở cái phút đầu, bắt đầu mình vô cái phần reading chapter 5 nha. Chúng ta nói về hệ thần kinh. Hệ thần kinh mình có chia làm 2 chương, nói về cái chương 5 trước. Rồi, trước khi mình bắt đầu vô cái phần bài tập thì cô sẽ cùng với các bạn tóm tắt một số cái nội dung liên quan tới cái chương 5. Ngày hôm nay chúng ta nói về the nervous system. Đây là một cái bảng tóm tắt đó. Và cô cũng thu thập những cái hình này trên mạng về structure and function. The nervous system is made up of the brain, the spinal cord, and all the nerves that come run between your brain and spinal cord. Even though they all together, and the techniques break down into 2 parts, the central nervous system and peripheral nervous system. Chia làm 2 phần. Thần kinh trung ương ngoại biên. The central nervous system is the brain and spinal cord. Thần kinh trung ương thì nói về não bộ và tủy sống, which runs down your back inside the body. Vertebral column. The CNS receives information by hệ thần kinh trung ương tiếp nhận các cái thông tin và quyết định là sẽ xử lý như thế nào. Còn đối với the brain là contains your entire personality and memories, đó là tính cách và trí nhớ. Cái là allows you to talk, cái này là có tool á, trên mạng khi nó cũng không có chính xác lắm về ngữ pháp. Listen and understand what people are saying. Mình có thể nói được nè, nghe được và hiểu được. Let you remember this morning or last year, giúp trí nhớ nè. This is where you understand things that are around you, like sensing heat, cảm nhận được nhiệt độ, rồi các cái vị giác quan, where you decide what to do about them. The peripheral nervous system, hệ thần kinh ngoại biên thì người ta nói là gì, bao gồm các cái nerves và các cái dây thần kinh outside the brain and spinal cord, ngoài não bộ tủy sống. Their job is to bring information into the CNS, và cái chức năng của nó là đem cái thông tin đến hệ thần kinh trung ương, and the orders from, và ngược lại ha, là nhận lệnh từ thần kinh trung ương out to the muscles, đến cơ and other organs, từ những cơ quan khác. This is the picture, thì đây là hình ảnh của mình ha, là brain, spinal cord. Đây là ganglion, là các cái hạch, và nerve, các dây thần kinh thuộc hệ thần kinh ngoại biên. Central nervous system with brain and spinal cord, và peripheral nervous system with peripheral nerve. Thì người ta phân chia hệ thần kinh trung ương và thần kinh ngoại biên. Về cấu trúc của một neuron là dendrites, pick up impulses. Cell body contains cell parts. Axon sends impulses. Neuron cells wrap around the axon. Myelin lipid covering form plasmon cells bits rate of impulse. Axon terminals, end of axon. This is a picture of a neuron. Thì một cái cấu trúc của neuron thì bao giờ nó cũng sẽ có cái terminals, đầu tận là axon sợi trụ, ba myelin sheath, cái tour guide dendrites, và cell body, thân tế bào, và nucleus, và nhân của tế bào. Đây là những cái hình ảnh khác nhau. Đây, như ta định nghĩa và chức năng của những cái thành phần, một cái parts of a neuron, mình có dendrites, cell body, nucleus, axon terminals. How do neurons transmit impulses? Thì đây là cái cách thức mà neuron nó truyền tín hiệu thôi. Nghĩa là nó send message to other cells. Number one, the dendrite receive a signal from another cell. Number two, an electrical impulse travels very quickly down the axon. When the electricity reaches the end of the axon, tiny molecules called neurotransmitters are released from the end of the axon. Nó truyền cách là nó phóng thích những cái chất dẫn truyền thần kinh đi qua cái neuron khác. The neurotransmitter travel to the dendrite, the next cell, và tiếp tục là nó truyền qua cái tour guide của cái tế bào tiếp theo, and trigger a new, và tạo ra một cái xung điện trong cái tế bào đó. Nervous tissue là mô thần kinh. Axon sends impulses away from cell body to stimulate or inhibit a neuron muscle or gland. Đây là một cái hình ảnh khác, người ta cũng tóm tắt cái ý đó. Là về central nervous system thì có brain, spinal cord, và contains relay neurons, sẽ chứa những cái neuron dẫn truyền. Peripheral nervous system composed of cranial nerves, spinal nerves, peripheral nerves, các cái dây thần kinh sọc sọ, tủy sống, ngoại biên, và nó chứa nhiều sensory neurons và motor neurons. Types of neurons thì các cái loại neuron người ta phân loại là gì các bạn cũng biết ha, đó là neuron vận động, neuron cảm giác, và neuron trung gian, interneuron. Thì đây là cái cách mà các cái neuron nó truyền thần kinh 1, 2, 3. This is sensory neuron, và nó truyền qua interneuron, và nó truyền qua tới motor neuron. Cranial nerves, đây là hình ảnh của cái dây thần kinh hợp sọ là 12 pairs, 12 đôi ha. Rồi bây giờ cô bắt đầu cô quay lại trong cái bài tập ngữ sách của mình. Đây là cái phần hình ảnh là tóm tắt nội dung. Mời các bạn bắt đầu mình chuyển qua phần thực hành ngữ. Phần thực hành ngữ thì chúng ta đi về phần vocabulary reading grammar. Thì trong đây á, là cái section 1 có một số cái task bài tập. Thì cô đổi slide. Thì để cô lướt qua một lượt để các bạn cùng nhau xem ha. Task 1 nè, bài tập matching ha. Rồi bài tập trả lời câu hỏi, tập true false, cho bài tập một chút, và cũng bài tập điện từ. Đây là bài tóm tắt. Thì chúng ta có tổng cộng là một số các bài tập nho nhỏ như vậy trong cái section 1. Now you have some minutes to prepare. Bây giờ mình có khoảng 10 phút để chuẩn bị phần bài tập này nha. You have about 10 minutes to prepare. Section 1. Mười tới 15 phút gì đó ha. Tùy cái tốc độ của các bạn. Trong 15 phút đi. Rồi, cô mời các bạn bắt đầu chuẩn bị bài. Time's up, mình hết thời gian làm bài. Bây giờ chúng ta bắt đầu sửa bài. Thì trong cái section 1, task 1 là phần matching definition. Chúng ta match control A, enable B, relay C, pull away D, form E, send out E, F, react G và fill H. For question and answers, we have A. Number 1, the upper and spinal cord. Number 2, it controls thought processes such as decision making. Number 3, it controls most reflex decisions. Number 4, it is an automatic movement. Number 5, it contains nerves, sensory receptors, and sensory organs. 6, they are cells or parts of cells. 7, they enable the body to feel things. 8, they are the ears, eyes, and nose. Đối với bài tập true false thì có câu number 1 với number 3 là nó đúng. Ý ha, 3 câu hỏi phải ý chưa đúng. Number 4, sodium, potassium. Number 2, cyanatic and bone. 3, synapse. 4, vesicles. 5, axon. 6, neurotransmitter. 7, receptor molecules là những cái phân tử tiếp nhận. 8, dendrites, nuclei. Còn bây giờ người ta nói mình là tổng hợp write no more than 2 sentences to define each of the specialized terms. Thứ nhất là central nervous system, the brain and the spinal cord form the central nervous system. They have overall control of the body. Peripheral nervous system thì đặc điểm của nó là gì? Contains nerves và relay messages to and from central nervous system. Sensory receptors là they are cells or parts of cells that enable the body to feel things such as pain, heat, and pressure. Number 4, sensory organs. Sensory organs include the ears, eyes, and nose. They form part of the peripheral nervous system. And neurons. Neurons are the major cell of the nervous system. And there are many different types of neurons. Number 7. 1, neuron. 2 là mình chọn 3 nè. 3 là mình chọn decision making là đưa ra quyết định. 4, myelin shift là 3 myelin signals là đưa tín hiệu. Current là hiện tại. Synaptic and bone vesicles, neurotransmitter, synapse. Rồi, đối với section 2 thì chúng ta cũng có một số task. Thì cô làm chung với các bạn task 1 nè, để mình đề 3 vào. Còn những cái task tiếp theo các bạn sẽ xem qua một chút rồi mình sửa tiếp. Ở đây chúng ta sẽ chọn ví dụ như multiple choice nhưng mà nó không có nhiều lựa chọn. Tiếp thôi. Về number 1 thì mình chọn là 24. Number 2, head. 3, afferents. 4, to. 5, from. 6, afferents. 7, one way. 8, two ways. 9, exit. 10, spinal. 11, two way. 12, 13, one pairs. Rồi cho phần tiếp theo á, phần còn lại các bạn đọc qua, các bạn làm thử đi, chắc khoảng tầm 10 phút á. You have about 10 minutes to prepare. And we will continue with the correction. Rồi chúng ta sẽ tiếp tục sửa nha. Time's up, rồi mình hết thời gian chuẩn bị, giờ mình cùng làm bài. Chúng ta qua task số 2, task 2. Có A chúng ta chọn là sharpness. B, potentially. C, respond. D, distinguish. E, environment. F, detected. G, deficiency. H, stimulating. I, patch. J, individual. K, stimulus. L, defect. N, perception. N, inherited. Task 4, we are the ends of neurons or entire cells. They respond to a stimulus in the internal or external environments of an organism. Number 3, they respond to potentially damaging stimuli. Và cái number 12 thì chúng ta trả lời câu hỏi là no, they don't. That's 5. Đây là một số cái thuật ngữ medical term, medical suffixes. Ví dụ như meningitis thì mình đi với itis. Ở đây mình lấy một số cái ví dụ điển hình. Mình có thể thấy những từ khác, những cùng cái đuôi là được. Task 6. Cranial nerves travel between the brain and other areas in the head. Number 2, the photoreceptors use a process called phototransduction to convert light into electrical signals. Number 3, tiny hairs inside the cochlea detect sound vibrations that enter the ear. Number 4, there are 31 pairs of spinal nerves that are attached to the spinal cord. Number 5, motor nerves travel from the brain to a muscle or gland in the head. Bài tập tiếp theo là bài tập Tourette syndrome á, các bạn phải chuẩn bị ở nhà bữa sau mình mới đi tiếp. Còn bây giờ thì các bạn phải lấy những sách màu hồng đó mà có một cái phần thuật ngữ mình chưa có dùng xài đến á. Bây giờ phần đầu là phần thuật ngữ. Còn phần sau grammar là mình đi xong rồi. Bây giờ con mời các bạn lấy sách màu hồng ra nha. Và cô share màn hình. Cái bài đầu tiên là bài Introduction to Medical Terminology. Tổng quan thuật ngữ. Rồi, mình làm cùng cái phần này với bạn ha. Bài tập đầu là match the suffixes on the right with the meanings on the left. Và toàn bộ cái thuật ngữ là đều là trắc nghiệm hết, là dạng trắc nghiệm hết. Hoặc là matching hoặc là trắc nghiệm. Rồi, đây là những cái thuật ngữ rất là phổ biến. Thì chúng ta match 1D, 2J, 3E, 4I, 5D, 6C, 7H, 8F, 9G, 10A. Rồi, với bài tập hay là mảng là ghi the meanings of the following prefixes. Thì đối với prefixes chúng ta có một số cái prefixes thường gặp. Thì người ta yêu cầu mình định nghĩa, thì ở đây các bạn có thể đối chiếu cùng với cô. Dial ghi là complete, full, pro là before, auto là self, a and đó là no. Hyper excessive, hyper deficient, happy above, upon, under within, retro behind, trans cross through, carry surrounding, x out, sub below, under và ring là back. Rồi, mình thêm cái bài divide the terms into word parts, tức là mình tách nó ra. Append, appendectomy ha, thì mình xỏ chéo được là xong. Select the correct answer and write it on the line provided. Trắc nghiệm ha. 1B, đây là bài tập 4 là mã. 2C, 3A, 4B, 5A, 6B, 7C, 8A, 9B, 10C. Next. Bài tập 5 là mã, người ta bảo mình là gì? Underline the prefix in the following terms and give the meaning of the entire term. Match vô. Đây là những cái từ về chuyên ngành. Branch of study và specialist thì có urology là urologist, gynecology gynecologist, rheumatology rheumatologist, oncology oncologist, nephrology nephrologist, neurology neurologist, pediatrics là các bạn check tới câu 14. Rồi chúng ta cùng check 7 la mã là number one neonatal, postmortem, hypertrophy, antibiotic, anticoagulants, antibody, syndrome, epithelium. Tám la mã. Complete the sentences using the correct form of the words in brackets. Là mình chia với lại từ nha. Number one là inseparable. Number two, examined. Three, microscopic. Four, surrounding. Five, epithelium. Six, singular. Seven, differentiation. Eight, regulatory. Nine, more slowly. 10, behaviors. Rồi, mình qua tiếp bài da. Mình qua tiếp bài da các bạn. Rồi, các bạn có khoảng 5 phút các bạn đọc qua thôi. Kết thúc cùng trắc nghiệm 5-10 phút. Rồi trên màn hình là chúng ta thấy là bài số 2 và cái kết thúc cũng như vậy. Thì thường các cái bài thuật ngữ từ 12 đến đi nó sẽ chia làm 2 phần. Phần A là medical terminology và cái phần B là cái phần practice. Là tất cả mỗi phần thì nó đều có 4 la mã cho A và 4 la mã cho B, và đều như dạng là chủ yếu là trắc nghiệm. Thì các bạn sẽ cùng xem với cô, ví dụ như bài A này đó, các bạn xem. Exercise 1. Match the word parts on the right with their meanings on the left. 1I, 2D, 3A, 4G, 5J, 6B, 7H, 10C, 9E, 10F. Exercise 2. Thì mình xác định xem những thuật ngữ này đúng hay sai. Thì thuật ngữ 1, 2, 3 nó đúng, và thuật ngữ 4, 5 á, thì mình muốn đúng thì mình sửa lại cái từ ở trong ngoặc là cái từ đúng. Để mà con sẽ là tumor hay là surgical repair. Rồi 3 la mã là select the correct answer. 1A, 2B, 3A, 4B, 5B, 6C, 7A, 8B, 9A, 10B. 4 la mã thì nó không phải là bài tập trắc nghiệm mà nó bài tập điện từ. Number 1, onychomalacia. Number 2, hypohidrosis. Three, rhinoplasty. 4, onychoma. 5, melanopathy. 6, onychectomy, cắt bỏ móng. 7, anonychia. 8, dermatopathy. 9, mycosis, nấm móng. 10, melanodermatitis. Rồi với bài tập 5 la mã. là bài tập matching. Matching những cái medical terms, những cái thuật ngữ với những cái từ vựng thông thường. Tức là có, đó là những cái dạng từ đồng nghĩa. 1B, 2F, 3A, 4G, 5I, 6C, 7J, AB, 9H, 10K, 11E và L, 12L. Rồi đối với bài tập B á, là phần practice in medical context, tức là mình điền cái từ vựng và trong các cái ngữ cảnh y khoa. Thì ở đây á, mình có thể điền là 1A, 2C, 3B, 4D, 5B, 6C, 7D, 8B, 9C, 10D. Rồi bài 2 là mã những cái từ đồng nghĩa ha. 1B, 2A, 3A, 4B, 5A, 6A, 7B, 8B, 9B, 10C, từ đồng nghĩa. Còn đối với bài số 3 đó thì mình tìm lỗi sai. Number 1B, như vậy đúng thì là X sở hữu số. Number 2C, cô đúng sẽ là produce. 3A essence, 4A background, 5D accompany, 6B includes, 7B recent, 8A combined, 9C surrounded và 10A là to avoid. Bốn la mã là mình biến đổi từ. Thì trong những cái ngữ cảnh này, number 1 là largest, 2 là strength, 3 response, 4 pigments, 5 loss, 6 distance, 7 flexible, 8 seed, 9 underlying và 10 homeostatic. File listening á, thì nghe hết một lượt đi là cô sẽ up lên trên Teams cho cả ba nhóm luôn. Up hết luôn những bài mà có cái file nghe ở trong sách nha. Còn giờ cứ để cho các bạn nghe chung trong lớp trước đi. Tại vì cũng không có nhiều quá, nó cũng có tầm khoảng 10 cái file nghe thực hành thôi. Rồi sau đó cô sẽ up lên trên Teams hết luôn, cô để cô tạo cái thư mục. Rồi bây giờ cô mời các bạn á là chúng ta vào cái phần thực hành nha. Các bạn quét cái mã code giùm cô đi. Chúng ta thực hành cho cái phần còn lại của buổi học. Và chúng ta sẽ chuẩn bị bữa sau á, thì các bạn sẽ chuẩn bị bài thuật ngữ của bài xương này và phần còn lại của bài reading của bài 5 nha. Rồi mình vào chat, cái mình quét mã mình thực hành như thế này.